So for the topic of non-contact injuries and what causes them and how to prevent them, what, from your point of view, would be just the answer to that topic, or for your opinion on it?
Yeah. So usually with non-contact injuries, you kind of have to look at it from a whole body approach, kind of consider lifestyle factors. Are they sleeping enough? Are they eating well enough to get their body with the nutrients they need? And then are they recovering well? So they're working out, but are they allowing their body to rest properly through different recovery methods? And then with the non-contact injuries, depending on the type of sport, how well are they playing it? Do they have good technique? Do they have previous injuries? So are they prone to injuries already? Mm-hmm. And then what kind of strengthening and conditioning are they doing? So we have to kind of look at the big picture kind of thing to really figure out what's going on and why it's causing. There's no real specific answer to it until you talk to the person and figure out their situation.
Because that injury history is that's a very easy way to kind of gauge a pattern. Because once it happens once, it's more prone to happen again.
Right.
Even on a small scale. And then with technique, the way I view what you just said with that is the athlete's awareness with the skill that's required. Mm-hmm. So example, if they're changing directions or having to plant their foot, if they stick that foot in the ground and they think they're able to bear weight on it, but they're not actually able to, that's where you can get those ankle rolls, especially.
Yeah.
And then with ACLs, with knee stuff, the knee doesn't rotate. Excessive torque is dangerous on it. So when some people actually have a habit of doing that to their knee, they don't time up with their upper body rotation, lower body rotation, which just kind of jams it up and creates that. I mean, look at Derrick Rose. He would always torque into his joints, and he was injury prone, very injury prone.
Yeah.
But yeah, that's you know this. That's the most common. This topic is what people spend hours talking about, obsessing over, about how to prevent non-contact injuries. But like you said, there's more to it than just the training aspect,
right,
of a corrective drill, of a activation drill.
Right. But those are important factors too when it comes to training. So gotta make sure the trainer knows what they're doing in terms of making sure whatever body part needs to be strengthened and to make sure it's functional so that it transfers over to their sport. But it's got to be sport specific training.
Mm-hmm. And then this might be off topic too, but even now, once we move into the rehab portion, the athlete we're going to work with, almost taking a high risk, high reward, like we talked about, approach to their late phase return to compete rehab stage is crucial, because that's where you build the confidence and almost from your perspective, what's your thoughts on on the mental side of it, because if the athlete is always thinking about the injury, but when he's doing a drill, an exercise, he'll never get over it.
Yeah. So usually with that, there's a couple of things we take the athlete through, sort of objective testing. So with certain injuries, we'll look at how well a muscle is able to produce a certain amount of force and benchmark that to other athletes that are playing that sport as well. So if you have ACL injury, we want to look at quad strength to see how strong it is. So usually a good strong quad is about 200, 300 pounds of force that you can produce comparing to a top NFL player. And so we'll benchmark that depending on the age groups and type of sport to give them that confidence that they need to make sure they feel confident using that muscle. And there's different drills as well, balance drills to see if they're able to perform, landing mechanics to see if they're able to perform with good form, things like that.
Mm-hmm.
And then the visual aspect, like you said, you have to also kind of talk to the athlete about thinking and visualizing that they're going to perform well and believe that they're going to perform well, have that emotional connection to it. Because if they psych themselves out,
nothing can help them at that point.
Yeah.
Yeah. And then to even add to that, what I think is just because of the risk is, not as used as much would be whatever got the athlete hurt, you have to do that once they're cleared, of course, and you have to teach them to do it correctly. But having them do what got them hurt is the best way, I think, it's for them to get over the injury. Because if that's what's scary, and they overcome it, I mean, that's what anything in life.
Right.
Once they get over that, okay, now I'm back.
Yeah.
Versus kind of beating around it and doing everything but that one thing that will ultimately always be in their head.
Yeah. You just got to start off baby steps and then work your way up to it. And then build it up even more from there.
Okay.
And that's how you get back to the game.